Hello and welcome to the Racial Equity webinar series. I'm Kinkini Banerjee, the Coalition Relations Director at USBC, and I'm so glad to have you join us for this session. The USBC holds this bi-monthly webinar series with funding support from the W.K. Kellogg Foundation. And the purpose of this series is to increase our collective understanding about social and racial equity and inclusion, and improve our capacity to identify and address root causes of equity, and to be able to work on systems level changes to advance health equity. The webinars are designed for participants at various levels of knowledge, awareness, and readiness to apply concepts and principles of equity to maternal and child health. We hope that these sessions bring ideas and inspiration for collaboration and co-designing impactful strategies, programs, policies, and practices. I hope you're a member of our racial equity learning community. The USBC has a bunch of different learning communities, many for our member organizations, but the racial equity is one that is a forum to discuss issues of structural and institutional racism within the reproductive health and justice field, and it's a great space to share resources and ideas and learn from each other. If you're not part of the community, please consider joining today. These webinars are part of the learning community. We have these webinars on each odd-numbered month. And then we share related materials. Today's session materials are also posted, so you can see that in the chat box. And there's also a discussion forum in the learning community, and often at the end of the session, we really have our audience sharing their resources as well through the questions box, and we ask you to continue the conversation and share these on the larger learning community. So folks who were not able to join us live can also continue and participate in the conversation. We also have a file library with selected readings. And for the racial equity community, we have beginners level readings, intermediate, advanced level readings. And we keep update as we get new resources. We post them either in the weekly wire and in the community. So please keep checking and sharing your resources, but also checking to see new ones as they come up. So this is where our USBC's working definition of equity is, where we think of equity as a lens through which we view the world to inform and guide the design of our strategies. We also bring you sessions where we look at ourselves and our organizations and how we can build coalitions and how we can build our own structures and cultures to reflect the inclusion and diversity that we want to see in the field. And finally, in our definition, equity is an outcome. Equity is a journey, and it is something that you constantly work on, and is realized when life outcomes are equal. So again, today's session materials are in the chat box. We know that many of our members of our network are not able to attend the session live. So the recordings, all of our sessions are recorded, and the recording will be posted in the racial equity learning community as well as on the public webpage. The links are below. And we will have about 20 minutes to 30 minutes for Q&A and discussion at the end of the session. Because we have a large number of attendees, attendees are in listen-only mode, which means that you can hear us, but we can't hear you. But we want this session to be as interactive as possible. So please send us your comments and questions as they come up for you during the presentation, and type them in the question box on the webinar control panel. And our coalition relations coordinator Miriam and I will facilitate the Q&A sessions. We answer your questions if you have things that we can answer in real time, and some and most of them we'll be holding to share with our presenters. So here's how you can type in your comments or question. On the right side of your screen, you should see a control panel. If you don't see it, click on that orange box with the white arrow and it'll pop back out. If you scroll down below the audio tab and on the questions tab, click on the questions tab and it'll open up a text box for you to type in. So, and also check your chat box or questions box, chat box through the session. If there are any resources or links that come up, that we will be posting them during the session as well. And if you have any audio problems or technical issues during the session, please email coalitions@usbreastfeeding.org and our staff member will be happy to help you. And that brings me to today's topic, cultural communities supporting breastfeeding in Kansas. The Kansas Breastfeeding Coalition, or KBC, created a designation called the Community Supporting Breastfeeding, or CSB. And this designation recognizes communities across Kansas who have a multifaceted approach to breastfeeding support. The CSB designation criteria include local breastfeeding leadership, peer support, maternity care practices, support in public spaces, workplace support, and childcare provider support. And a community is defined both by geography as well as culture. So in community and we are looking at, today we will be looking at how the CSB, or the Community Supporting Breastfeeding criteria, were adapted to an Indigenous community and to African American neighborhoods in Kansas City, how the community strengths were harvested and utilized and leveraged to build a landscape of breastfeeding support. I'm delighted to introduce our presenters. Stefana Rupnicki is a recognized member of the Kickapoo tribe of Kansas. Stefana graduated from an all-native high school as salutatorian and went on to graduate with honors from the Highland Community College with her Associate of Arts in Fine Arts. She also has a degree at Washburn University for Fine Arts. She's been married to her husband, John Rupnicki, who's an enrolled member of the Prairie Band Potawatomi tribe in Kansas, and they have 5 sons. And Stefana is pregnant with her first daughter, so congratulations on your pregnancy, Stefana. Stefana also works with the Prairie Band Potawatomi Nation's first ever breastfeeding peer counselor and is based out of and works out of a health clinic there. She's the co-founder and leader of the coalition, an active member of the Kansas Breastfeeding Coalition, and she's one of our Tribal Trailblazer awardees, USBC's Tribal Trailblazer awardees. We were so honored to recognize Stefana's incredible work in the community in the 2019 conference. Stefana has a passion for breastfeeding support and advocacy, which led her to where she is today, and she really believes that support leads to successful breastfeeding journey. So welcome, Stefana. We're so glad to have you present today. Our next presenter is Dr. Stacy Yeager, who's a life coach and author. Stacy has extensive educational background in business and has a specific focus on organizational leadership. Dr. Yeager is the founder of a Facebook group called Breastfeeding Support Group for Black Moms, and it has over 76,000 members nationwide. And Dr. Yeager recently led the Kansas African American Breastfeeding Coalition in completing their designation for the Community Supporting Breastfeeding designation. And we are so honored to have both Stefana and Stacy with us today. And with that, I'm going to turn it over to Stacy.
Thank you so much for joining us here. Stephanie and I are looking forward to presenting the following information to you as it relates to the cultural community supporting breastfeeding in Kansas.
Hello. This is Stefana Rupnicki. I'm gonna go ahead and do the next few slides, and then Stacy's gonna go on her presentation. So how does Kansas compare? Like most of the US, most families in Kansas start breastfeeding, but just like the rest of the country, families find it difficult to continue breastfeeding. This is a symptom of a broken system, not failing families. We know all too well that many barriers families face when accessing breastfeeding support and in encountering unsupportive environments and policies. Kansas is, however, one of only 4 states to exceed the national rates and the Healthy People 2020 goals and improve our rates over last year's rates in each of these 4 core measures. Like many of you, we are trying many things to build a culture of support in breastfeeding communities. Next slide. But while breastfeeding is important, it is not accessible for many families. In Kansas, we have racial and ethnic disparities in breastfeeding and initiation. The gap between Black and Native American families and white families is more than 10%. Next slide. When looking at rates of exclusive breastfeeding through 6 months, we see the gap in Kansas persists at about 10% between Black and white infants. According to the available CDC data, this is a complex issue and one that we must address together. A rising tide of breastfeeding support approach isn't enough when some families in Kansas aren't even on the boat. The answers can be found from within these communities, and we are here to share how we found answers within our communities, the Prairie Band Potawatomi Nation and Black community of Wyandotte County. Next slide. We realized that to improve breastfeeding support, it was going to take the entire community building a culture of breastfeeding support. It was going to take more than just one lifeline for a family like a great hospital, birth, experience, or breastfeeding support group. We needed to weave these lines of support together to create a net support through which no family would fail. And those holding the net needed to be from within the family's community. Next slide. The Kansas Breastfeeding Coalition, KBC, began by asking these questions. What would a breastfeeding utopia look like? What would mothers and babies experience there? What would they see and hear? Would more families be able to breastfeed and breastfeed for longer in communities where multiple breastfeeding programs were in place, all working strategically to weave a net of breastfeeding support for all families? Next slide. We are fortunate in Kansas to have partnered who are asking the same questions and curious about the answers. The Kansas Department of Health and Environment, KDHE, Bureau of Family Health, responsible for Title V, WIC, and Childcare Provider licensing, was interested in these questions as well. More importantly, the answer. The resulting conversation and meetings between the Kansas Breastfeeding Coalition and our partners formed the basis for the Community Supporting Breastfeeding, CBS designation, to recognize communities to provide a multifaceted approach to breastfeeding support. The Kansas Health Foundation and United Methodist Health Ministry Fund supported the CSB designation after the pilot year. The University of Kansas School of Medicine, Wichita helped to capture data from the surveys given to parents and communities who achieved the CSB designation.
As you see on your screen, the community supporting breastfeeding designation, it all had to encompass a wraparound approach. So the community supporting breastfeeding designation program started in 2014, where we recognized that communities here in Kansas who are part of building a culture of breastfeeding support systems across environments result in long-term success. In order to improve exclusive breastfeeding rates, community across Kansas had to come together to form this partnership. Communities can be cities, counties, cultural communities, as we'll explore shortly. Now, applications for this designation, it can be submitted at any time. However, it does require communities to meet 6 criteria, which is represented in 6 areas of support, in which you see on the screen. And the critical strand for the net support also means that families are able to continue breastfeeding, because we know that as that mom feels supported breastfeeding that baby and her family are supported and feel comfortable, we know that that results in long-term breastfeeding. So the 6 criteria selected based on at least one of these 20 action steps are in the U.S. Surgeon General's call to action to support breastfeeding. So you have societal support, leadership, childcare providers, employer, peer support, and maternity care. Each of these areas we will talk about in the upcoming slides. So first, our criteria. As we look at the Breastfeeding Coalition, the community must first have a local breastfeeding coalition. And we define a coalition very loosely. Basically, it has to have 3 or more people gathering in the name of breastfeeding. Isn't that exciting? So 3 or more people, as long as they come together and have that passion to help breastfeeding, they can be part of a community. In our rural communities, we know of hospitals, health departments, and one other program person come together to support breastfeeding families. They can accomplish a great deal of work by supporting each other. This criteria is designated to address the action steps of 20 as discussed in the Surgeon General's call to action, which calls for improvement of national leadership on promotion and support of breastfeeding. In Kansas, we seek to improve local leadership to promote and support breastfeeding. The KBC supports local breastfeeding coalitions through quarterly conference calls, startup meeting facilitation, meaning that they will help us in a way that we can be successful with that facilitation of meetings. We also have a toolkit for breastfeeding coalitions, and the link is as shown on your screen if you needed a reference for that. We also have annual conferences that are free, and attendees are given free membership to the KBC for the following year to help them stay connected and know what's going on in the breastfeeding field in Kansas. And basically, when we have these meetings and get-togethers, it's a time for us to put our heads together and say, hey, what are some best practices that you're doing in your area that I can adopt in my area? It's not stealing of ideas, it's more like a brain thinking take, a brainstorming. And those meetings are very beneficial because sometimes you may be stuck in an area and think that it's only your coalition struggling, where in reality others have gone through it or they are currently experiencing it. So it's really important to have that meeting of the minds per se. And the next area of the criteria is the peer breastfeeding support group. So that's where 43 WIC peer counselors in 46 counties, and they also must be designated as an action step 3, which is on the Surgeon General's call to action, which is to strengthen programs to provide mother-to-mother support and peer counseling. So for the purposes of the CSB criteria, this would be a traditional group or a social media group. The CESB criteria also outlines who is eligible to facilitate the support group, either on person or online. Community members can receive free training online via Kansas Train under How to Start a Breastfeeding Support Group using the Kansas WIC Breastfeeding Peer Counselor modules, and that's where it's located under. And we've had several communities to start a support group led by parents from within the community who are passionate about breastfeeding and who support the online training modules. And this is kind of how I became engaged. As a mom in Wyandotte County, I created an online breastfeeding group because I noticed that I did not have as much support as a working mom that I needed. Sure, there would be meetings in the middle of the day for moms, but because I had to work outside of the home as well as try my best to know about breastfeeding, I thought it was best that I educate myself. And from that, I started that online breastfeeding group, which now we're at 78,000 members and constantly growing every day. But it's important to think about the online component. Many women work outside of the home now, and in order to capture women who are busy and may not be able to make a physical meeting, that online component is something that we should also consider. The next area that we'll talk about is hospital designated as high five. And when we think about this area, one or more hospitals where families from the community must give birth at a designated high five for mom and baby hospital or baby-friendly hospitals. High five for mom and baby is a state program that recognizes hospitals who have successfully implemented the 5 maternity care practices. And those 5 are: 1, assure immediate and sustained skin-to-skin contact between mom and baby after birth. 2, give newborn infants no food or drink other than breast milk unless medically indicated. 3, practice room in, when the baby is actually in the room with the mother that time. 4, give no pacifiers or artificial nipples to breastfeeding infants. And of course, we know that reduces the instances of nipple confusion. And practice 5, provide mothers with options for breastfeeding support in the community upon discharge. So that means even after their discharge, there's someone who is following up with them to encourage them. Because we know supportive hospital experience is vital to starting and sustaining breastfeeding. This criteria is designated to address Action 7 to ensure that maternity care practices around the United States are fully supportive of breastfeeding. When I had my baby, the hospital where I gave birth was baby friendly. And they were very supportive of not assuming, because statistics show that African American women across the country are generally offered formula feeding even before they're offered or asked if they're breastfeeding. So because I delivered in a high five area, that meant that when I was in the hospital, it was just automatic. Hey, we're going to bring in some nurses to help you breastfeed, and it was great. And our goal, even with our support group here in Kansas, is that moms know that they have options and to let their feelings be known, even if they deliver at a hospital that is not baby friendly, that they too can request to have no bottles be brought, no pacifiers as an option when they have their baby. So it's important that this is our criteria for our coalitions and with the support to help provide additional knowledge. The next area we'll talk about is one business for every 1,000 community citizens, or 25, whichever is the lesser, participate in Breastfeeding Welcome Here. And the community must have a minimum number of businesses and public establishments that display Breastfeeding Welcome Here, which is the window decal that you see above. And you'll see when I go through the slides below that We also customized a decal for African American community so they would be able to identify with the Breastfeeding Welcome Here logo. The number required to meet the criteria is based on the community's population. It's typically capped at 25 to make it achievable. Larger communities often go well beyond the 25 businesses required. And this criteria is designated to address the embarrassment that new parents may experience when breastfeeding in public, which is action step number 5 from the Surgeon General's call to action: create a national campaign to promote breastfeeding. For the purposes of CSB designation, we see that the local campaign to promote breastfeeding really helps new moms and parents feel comfortable. Seeing these signs in the community allows everyone to know they are welcome to breastfeed in public and is totally normal. It also impacts teenagers, grandparents, and children. When you see yourself or others breastfeeding, the likelihood of you considering breastfeeding in communities have a very large impact, which is really important to the communities that we serve here in Kansas. The next area is businesses. One business for every 5,000 community citizens, or 10, whichever is lesser, receive the Breastfeeding Employer Support Award. And communities must have a minimum of employers who receive this award. To meet this criteria, it's based on community's population again, but it's capped at 10 to make it achievable. Larger communities often go well beyond the 10 required, but the criteria is designated to address the action step number 14. Ensure employers establish and maintain comprehensive, high-quality lactation support programs for their employees. We know returning to work in an unsupported work environment is very detrimental to new moms. Also, returning too soon after birth is one of the leading causes many parents stop breastfeeding. And when we look at the businesses that we select for the business case for breastfeeding, we present it to employers and talk about the communication plan before they leave on maternity leave and when they come back, a policy template that they can use for all employees, as well as a site visit. Because the standards are gold, silver, and bronze, we want to be able to see what the employer has to offer and provide suggestions with them as to how they can meet the gold standard. And one of the things when I did my site visits to businesses, there was just a little tweaks that they did in order to achieve the gold standard. Many times employers did not quite know what to put in there in order to make it more friendly or welcoming to new moms. And they always appreciated having that extra eye, look at them, look at their nursing area, and help provide guidance to them. The next area we'll discuss is childcare providers. So communities must have at least 20 childcare providers who have completed the 2-hour course, How to Support Breastfeeding Families. This number has been adjusted in a few rural communities to 75% of the licensed childcare providers in their communities. We are fortunate to have a partnership and funding to be able to provide this course free each month online through the Kansas Childcare Training Opportunity Organization. We also provide it in person when requested. This course is approved for professional development hours that are required for licensing in Kansas. It also is in alignment with the state and national childcare regulations, and also addresses step number 16 of the call to action to ensure that all childcare providers accommodate the needs of breastfeeding mother and infants. And you may be thinking, well, how do you get all these providers in one place to do this type of training if it's in person? When my coalition was going through this, we partnered very closely with WIC so that during the normal monthly child care licensing training, we tagged with them and we were able to do it in partnership with the childcare licensing area of Wyandotte County. So that worked out really well, and we did have over 20 childcare providers who came. And I like the idea of it being in person, just because you got a chance to answer those questions or special situations that may not have been available if they took it online. But both options are available, both online and in person when requested. The next area we'll talk about is coming up on the screen, 28 communities supporting breastfeeding. And these 28 communities impact over 80% of all babies born in Kansas. They are now designated communities supporting breastfeeding, having met all 6 criteria. We would now share with you a couple of the 2 cultural communities that met the criteria. I will talk about the African American portion, and then Stephanie will come back on and discuss the other areas. So in the African American neighborhood of adoption of community supporting Wyandotte County, I first became interested because I partner a lot with Uzazi Village in Kansas City, Missouri. If you've ever been to Kansas City, as you know, we are so connected with each other. Kansas City, Kansas, and Kansas City, Missouri are connected very much so with each other. And I was recommended to be part of this movement with the Kansas Breastfeeding Coalition to help more African American families breastfeed. And adopting the CSB designation, our area was defined by the local African American Breastfeeding Coalition based on lived experience in communities. Also, there's a map on the next page that I'll go to, identifying the African American neighborhoods within the area. And this is actually from the Health Equality Action Transformation Report, which is called the HEAT report, that discussed what areas were primarily African American. As you see on the screen, the blue area is the primarily African American area. And in this, they found that this is the most likely area that had lower instances of breastfeeding, and where we could gather to ensure that everyone knew about how to get breastfeeding resources in our area. The businesses within there were very vital to ensuring that people saw themselves represented when they see the logo Breastfeeding Welcome here, as you see on your screen. This represents an African American mother breastfeeding. And the importance of making it symbolic to see an African American woman is because many times when we talk about breastfeeding, or if we do a search for general breastfeeding mom, African Americans are not represented to the same level as European Americans. So therefore, sometimes in the community within African American, you may not see anyone else who looks like you who have breastfed. So it was really important to have this logo on businesses so they could see, hey, our community does breastfeed. The next thing was to create a partnership with Uzazi Village so that I could be certified as a chocolate milk cafe facilitator. KBC funded myself and Aaron Huggins to be trained as leaders from Uzazi Village to facilitate a chocolate milk cafe at Providence Medical Center here in Wyandotte County, in which we discussed the importance of providing support to families. If they happen to have their baby at Providence, then we were notified of someone being there who may possibly need our help. Of course, no HIPAA violations occurred because it was just a notification of, hey, there's someone who requested you to visit. Providence is not one of the baby-friendly hospitals in our community. Therefore, only in other situations to where Only 300 babies a year are born at Providence Medical Center. A majority of them are at KU Medical Center, where a majority of our moms give birth in the community. Also, there was newsletters put out to help moms know when the Breastfeeding Coalition met, and also there was a lot of connectedness. The next area was the Childcare Providers, friends and family. So we opened it up to anyone who was a parent or whoever watched the baby in our community. We opened up the training so they could come and know how to take care of infants. Also, if you're not used to what breast milk looks like, there's a lot of assumptions, oh, throw the milk away because it's separated. Again, it goes back to education. And one thing to know is that providers are one of the #1 influencer if a mom will continue breastfeeding. So if she gets positive reinforcement from the provider, you're doing great. The milk you're sending is the perfect amount. Send a little extra to a growth spurt or things of that nature. The positive way in which they talk about breastfeeding leads to long-term success. The next area was the award-winning employers. And this one was the Kansas City, Kansas Public School. We worked with them to ensure that they met the gold standard and recognized that there was a need for pumping rooms for both faculty and staff, as well as a plan for teachers. So that too was important. The last area was a celebration. We again celebrated at a local restaurant, Mrs. R's Cafe, to celebrate the designation. And it was nice to have the event in the community. The owner actually breastfed all of her children back 40 years ago when it wasn't as popular. And she's really a strong advocate of breastfeeding support, and she also talks about the group a lot. Lastly, we want to thank our funders. The Prime Health Foundation funded, and the Kansas Breastfeeding Coalition were the primary funders of the African American Breastfeeding Coalition, and we really appreciate their partnership and their dedication to helping Wyandotte County. Stephanie is next with her portion.
Hello again. The 6 CSB criteria were adapted to define community as the Prairie Band Potawatomi tribe in Kansas. We achieved the CSB designation in June 2019. Next slide. Oops. This is the wording of the Tribal Council resolution passed in June 2017. Each of the 6 points in this resolution was adaptation of the CSB designation criteria for the PBPN and our community on the reservation. If you are not aware of how tribes go about we have our own government system. And so in order for us to have anything presented to our community, we have our tribal council go through it and they make a resolution. Our tribal chairperson signs the resolution, and then it gets put into our policies. Next slide. All the quotes are directly from the tribal council resolution that you had just seen. Formation of the Prairie Band Potawatomi Nation Breastfeeding Coalition. Convey a breastfeeding committee comprised of a minimum of 3 individuals from the tribe that will meet at least once every 3 months for the purpose of supporting and promoting breastfeeding within the tribe. Co-founders included myself, Jessica Wheeler, Michelle Torres, Allison Catron, Gail Lambridge, Hope Adami, new members Cheyenne Simon and Casey James. We started meeting in February of 2018, and we met monthly for the first year and then switched to every 3 months with email meetings in between those months. Next slide. The tribe met with language elders to come up with the wording for the window clings, as we don't have breastfeeding support as an everyday word in the Potawatomi language, same as with the Kickapoo tribe of Kansas. The message that convey on this window cling is the act of breastfeeding and it being welcomed. It's a long process of going through, and we kind of just storm words and try to convey our feelings about breastfeeding. And so this is how we came up with the wording in our language for the window clings on all of the government buildings on the reservation. Next slide. We had a 2-hour training that was given by Brenda Bandy. She's the director of KBC, Kansas Breastfeeding Coalition. We had it at the Child Care Center, and it was all open to all home visitors, parents, community members. I myself, the breastfeeding peer counselor, was present as well. It was a very great training. We had a good turnout, and I like the fact that it helped show and teach the child care providers how to properly bottle feed a breastfed baby, because it is a little bit different. And then also how milk composition, how it looks, and just how it's a precious commodity, and so that they know how to properly care for it. Next slide. Tribal government has a policy and employee handbook that all tribal breastfeeding employees will be given break time and a private non-bathroom space for pumping. This adopt and workplace lactation support policy was for all of the tribal employees, and also the casino was implemented with the same policy, although the casino employees are not tribal government employees. And in our policy, we support parents that pump till the baby is of age 3. Next slide. The Prairie Band Potawatomi Nation Breastfeeding Peer Counselor was created with the help from the Kansas Breastfeeding Coalition, KBC, with some funding for the first year. The breastfeeding peer counselor position would need to take the same training that the Kansas WIC breastfeeding peer counselors take. After the first year, the Prairie Band Potawatomi Nation Health Clinic added the breastfeeding peer counselor to their budget plan, and now the breastfeeding peer counselor is based out of the clinic, working mostly from home, and is available 24/7. I'm available to come to mom's home. Upon request, I will come to the hospital to help with the first days of breastfeeding. I'm accessible via text, voice, and messenger to all my families in my community. Now, my community is pretty big. We have about 8,000 tribal members in our community. I'm available to all 8,000 tribal members, their families. And then on top of that, I'm available to all of the tribal government employees, and then also to all of the employees at the casino. Now, our tribal members don't all live on the reservation in Kansas. We have them spread out throughout the United States. So I do help moms throughout all of the 50 states if they're there. So I'm pretty broad of where I help offer support. Next slide. Here are some flyers I have made up over the course of my 1.5 years being the breastfeeding peer counselor. As also the co-founder of our Breastfeeding Coalition, I also am the leader of our organization. I created a program flyer to help my community know what my position entails. I also host breastfeeding support groups. This is one of my flyers. I manage the Breastfeeding Peer Counselor and Breastfeeding Coalition Facebook page as well. And I, along with my fellow coalition members, host a lactation station at our yearly powwows. And here's one of our latest flyers. Now, we usually have several powwows throughout the year, but our annual powwow is usually in the summer. And our very first lactation station and informational booth that we did held was at their 25th annual gathering of the tribes, which is all of the Prairie Band nations. in this United States. Next slide. I partnered with Kickapoo Nation, which is another Native American tribe in Kansas. We have about a total of 4 in our state, and we work closely together. The Kickapoo tribe wanted to host a breastfeeding class in support of World Breastfeeding Week and reached out to me to present the class, as they do not have a breastfeeding peer counselor themselves yet. It was fun and exciting with a great turnout. We had about 20 moms and their babies along with their support system person in attendance. I made sure that when I was talking with the coordinator of this class, that it was to be known that they were able to bring their support system. Because if we don't have their support system on board, their breastfeeding journey is not going to last as long as if they hope. It's because it's really important to have their support system on the same page and understand why this is important. I included this in my World Breastfeeding Fund as well. On our Coalition Facebook page, I hosted 7 days of breastfeeding information and education, and with interactions to those posts, I had a drawing giveaway. My World Breastfeeding Week was pretty successful. I had well over 20 moms that participated with me. It was really fun and engaging, and getting to hear my community moms, their stories, their backgrounds of when they have breastfed their oldest ones to their newest ones, and also to find out what their struggles were and how I can help improve upon that in my community. Next slide. Number 6, health center staff training. Health center staff that treats pregnant women, mothers, and infants will complete 2-hour on-site breastfeeding training. 25 health center staff, including all physicians, attended this 2-hour training by the Kansas chapter of the AAP. The center is working toward the breastfeeding friendly practice designation from the Kansas AAP. Our reservation has their own health clinic, so it was really nice that we were able to do that. Next slide. Funders. These are the organizations that provided funding to support this endeavor. Kansas Health Foundation, Kansas Department of Health Environment, and the Kansas Breastfeeding Coalition. Thank you so much. Next slide. Oh no.
Thank you so much, Stacy and Stefana, for an incredible, powerful presentation. Just checking, do you, we have your email addresses over here, and I'm going to, are we open for questions? Yes. Okay, well, this is just, thank you again for this powerful presentation, but it tells you how important it is to have the kind of collaboration framework to be able to do multi-objective and multi-outcome systems level changes that you all are doing in Kansas. I loved the idea of a coalition of three people. As long as you have that building that leaderful movement was so fantastic, using data, where if you look at the overall picture, you can say Kansas is doing better than the nation and is exceeding the Healthy People 2020 goals, but looking at the disaggregated data is where it is, and really focusing on where change needs to be made. So wonderful, wonderful presentation. We have a question from and we also have the Executive Director of Kansas Breastfeeding Coalition, Brenda Bandy, on the call to help to support and to answer any questions that might be for KBC. So Stacy, and as we are looking at the work that you are doing, how does, I think there was a report that you used, which was the Health Equity Action Transformation Report, or the HEAT report.
Yeah.
Was that a county level thing or a state level report that you used?
It's a county report that was funded here in Wyandotte County so they could determine what areas to focus on in the community to help with health disparities. And the organization that was able to put that on brought us in and talked to us about how we could help strengthen the health in the area of Wyandotte County because that was the majority area of need.
Wonderful. And that is really the power of local data and being able to use that. We have a question from, we have many comments saying that this is wonderful. Is it, would Kansas be willing to share the ECE provider training materials? Would that be a Brenda Bandy question?
Yes, this is Brenda. Can you hear me?
Yes, Brenda.
Great. Yes, we are happy to share the childcare provider training. We've already done so with Virginia, and we would be happy to do that. And any of the other resources or programs that you heard about today, happy to share.
Terrific. And also the toolkit that you have on breastfeeding. So you can see in the chat box, we've Miriam and Brenda have posted links to some of these. So wonderful to know that. Tell us a little bit about, Stefana, if you can talk to us about the Tribal Council resolution about the workplace lactation support policy, and how were you involved in that, and how did it come about? And you said that there is a support, workplace support for babies until the age of 3. Is that in your Tribal Council?
Yes, actually, this all was formed before I became the breastfeeding peer counselor. Brenda Bandy met with them, and everything got worked out in advance. And then that's how they included a breastfeeding peer counselor within that resolution. And yes, it does. We support breastfeeding, extended breastfeeding in our community. We have many moms that breastfeed well past the age of 3, actually. And so it was important to have that for our parents because we know that's going to be a given in our community.
Wonderful, thank you. And I
think
Kenny,
this is.
Go ahead, Brenda.
Oh, this is Brenda. I was just going to say that 2 things that I think were important about the Tribal Council resolution is who we talk to set the stage for that. We first started with the Tribal Council elders, and then we also spoke with the council manager, which is kind of the equivalent of a city manager, in order to get it on the agenda. And then we did have to work with the casino separately because, as Stefana said, they're not governed by the same HR policy. So we did work with their HR separately.
Okay, wonderful.
Yeah,
go ahead, Stefana.
It's kind of like we're our own little world, our country, I guess you would say, within the United States. So we have our own president, even though it's called a chairperson. So it's kind of confusing for people to understand how we do things.
Yeah. And it's impressive, Stefana, to hear that you have, because your tribe is spread over all 50 states. So it's not the work that you do with your tribe is not just in the state of Kansas or on the reservation, but in urban areas and across the country. So that is why you are just such an amazingly transformational leader. The other thing that really struck me was that right now you said that there were over 3,100 licensed childcare providers that had got that training. So that's 75% of licensed childcare providers across Kansas, and um, that's a sizable. Over how long has these trainings been? Has it been since 2014, 2015? Over how many years?
This is Brenda. I think I can take that question. So that's a little over 3,000 child care providers since 2013. So it is over the course of the last 6 years. It's not, that wouldn't reflect the number that are licensed today. Does that clarify?
Yes. Thank you.
Okay.
And then about Stefana, are there, with the success and the incredible traction that you're getting with the Potawatomi, I'm sorry, I'm not saying that really pronouncing that well. Could you pronounce it for me, please?
The Prairie Band Potawatomi?
Potawatomi. Okay, thank you. With the tribe, are there other tribes within the state of Kansas that are, you mentioned the Kickapoo, who doesn't have one yet. So is that a possibility? And are there other tribes that that you are also connecting with?
Well, yes. When I had the breastfeeding class with the Kansas Kickapoo tribe, we had discussed about them having their own breastfeeding peer counselor. And the project coordinator was letting me know that they are working closely with, I think, KBC to see about getting this going. And I let them know that I would love to be supportive and meeting who might be the potential breastfeeding counselors and helping them know how I've been doing my work for the almost 2 years coming up this April of the new year. I'm not sure yet if anyone has spoken yet with, because we have the Iowa tribe and then we have the Sac and Fox tribe in Kansas as well.
Mm-hmm.
And then myself, I've reached out to other tribes that had breastfeeding coalitions and just wanted to see how they go about their organizations, and then also how they advocate breastfeeding support in their communities. So I had reached out to the Navajo Nation. I also reached out to some North Dakota as well, and a couple other, and I also got to meet with them when I went to the conference in June when I accepted the Tribal Trailblazer Award. So, but yeah, I guess that
Wonderful.
hopefully that answered it.
No, that's great. This is how the connections are made. And earlier this year, Cami Goldhammer and Kim Salas-Moore presented about the Indigenous Breastfeeding Counselor training, which is a 5-day, 45-hour course that provides, not just foundational lactation education to Native people, but also coalition building, support and help and resources as well. And the IBC is unique in that they really have, they center breastfeeding Native culture in the coalition formation as well. So that's been an amazing way in which they've been going across the country and helping Indigenous tribes set up their own breastfeeding coalitions as well. So it's really foundational to the work that they did, and also with the idea that a coalition leadership, the kind that you all have, is essential to Indigenous resiliency. So thank you again for what you're doing. Question for Stacy. Stacy, you mentioned Uzazi Village and the work that you had done with that. And I know that Uzazi Village also with Hakima Payne, there's just so much done work being done in the life course. So there's a lot of work that Uzazi Village now does in looking at maternal infant health disparities, but also in the birthing field. So is that something that your county coalition, or as you expand your Facebook group, are you also looking at improve the maternity care practices? Yes, but prenatally support for mothers through their, prenatally and preconception, intraconception as well?
Yes, well, we partner a lot together because, again, Kansas City, Kansas, and Missouri, since we're so close together, we share a lot of resources. So a lot of times we do refer moms before they have that baby to understand health, because we know the infant mortality rate in the United States is, it continues to rise, as well as maternal mortality in the African American community. So we are all hands on deck when it comes to helping that mom with the wraparound approach to ensuring that she gets the medical care that she needs. That's one thing that makes Uzazi Village so unique, is because the goal is to embrace the whole process of, conception, birth, through the doula, program and things of that nature. So I would say that is a very important part of something that we do.
Thank you, Stacy. And I think that that's so vital of what groups that are centered in Black maternal infant health are doing, is where they're incubating really innovative practices for healthcare delivery, as well as maternity care practices that really center on the on women of color, or of parents of color. And so that, as one is thinking of maternity care practices across the state, really centering those models and those elements in the practice would be helpful to beneficial to the entire population. It's really you're helping reframe so much of the narrative in the work that you all do.
And
Thank you again.
And I would mention that once we did get the alert to help families understand breastfeeding more in the Black community, I started a group for dads. They don't specifically have to be Black, but they have to be married to a Black mom. And it's called Daddy Can Do Breastfeeding Support for Dads. And that group has over 2,000 men in there to help encourage each other. So there's a lot of seasoned men who are now talking to younger men about how to support their spouse or significant other through the breastfeeding journey, and be an advocate for them, again, while they're pregnant, at the hospital, having the baby, and afterwards. And so the main group is now called Black Families Do Breastfeed, to have the umbrella of both groups together.
That's terrific. Breastfeeding exists in context and family, having partners, fathers, grandparents support is great. And so often partners are very overlooked in the process when we talk about the mom-baby dyad. So it's really great to hear that you also have an initiative for partners. Wonderful. There's a question here, which what were some of the goals going into getting that, creating the community supporting breastfeeding designation, and how has the designation helping with promoting and supporting breastfeeding in your communities? So, open to any one of you.
I think for the Black community, it helped with awareness, especially surrounding about Black Breastfeeding Week. We had a series for a full week to discuss the importance of Black Breastfeeding Week, as well as encourage moms to post pictures of themselves breastfeeding so that there would be updated pictures of a variety of ages of women and colors who breastfeed. So the goal was to ensure that when a mom is looking up the word breastfeeding, that they will come across some of our videos or images to know that it will soon be the new norm for Black communities to just breastfeed. That will just be the new thing, is a new normal in our community for them to see.
Wonderful.
And
Really. Mhm.
for myself, I started my breastfeeding journey back in 2010. Uh, I didn't have access to a breastfeeding peer counselor whatsoever, not even through WIC at that time. And our hospitals weren't breastfeeding friendly. So I think over the course of the years and having the CSB designation and such has really helped, I think, bring breastfeeding more to the public forum. I know it's something in our community we just do anyways, but I had started to see a lot of younger moms that would come to me because they knew that I breastfed and
Mhm.
asked many questions. And by the time I had my third child, which was in 2013, I was able to have a WIC breastfeeding peer counselor, and she helped me tremendously. I went from breastfeeding my first for only 3 months, my second for 5, to my third breastfeeding for 26 months. And it was because of a WIC breastfeeding peer counselor. And I told her, we need something for my community, because I reached out to her and she said, you know what? I don't really get as many of the Native American moms that I'm able to support because, and it's understandably, she's not Native American. So I was like, well, we need
Mhm.
this. And since it happened, I mean, it took a long process to happen, and then it finally came to light in 2018. And I was the first breastfeeding peer counselor. I think it has improved a lot. I have a lot of young moms that I speak with. And I don't think if we had this, I don't think they would have continued to breastfeed or would have breastfed at all.
And
Absolutely.
that, and I would say that is so true because, you know, with younger women, as you try to talk to them about breastfeeding and the idea of it, if their parents or grandparents did not breastfeed, it's a little harder to understand what is going on when something appears to happen. Like if the latch is not right, it's so discouraging. And with the online, we found, and of course, I started the online breastfeeding group when my son was 3 months old, and he's 6 years old now. But the average breastfeeding in my group is probably about that 24-month, 2 years. And a lot of them go past 2 years because we encourage self-weaning. I myself went 3 years with my son. So it's just bringing back that knowledge. And as Stephanie said, is that when they know that, oh, you breastfed past teeth, it's a different mindset
Mhm.
Yes.
completely.
Yeah, so powerful, even as you're, creating, helping make this the norm, but you're shifting the narrative for providers because Black families do breastfeed, Native families do breastfeed, and you need support changes everything. Everybody needs that
Right.
support in those early. And if you have that, then and address what a transformation it can make. This is really powerful.
And
I had a question for Brenda, and that is, you've been with the Kansas Breastfeeding Coalition from the CSB days before forming the designation, and you'd spoken in the past about that creating that a network, a weaving of support. How has that process been, and how transformational has it been to scale some of your efforts, knowing that there's this incredible network that covers all of these different sectors of action areas of the Surgeon General? Brenda, that question was for you from Kansas, creating the CSB designation, and how has that helped scale? Your line might be muted. Oh, well, we can't hear Brenda, but let me see.
I would like to say that.
Go ahead.
Until we can hear Brenda, maybe. But Brenda has been.
This is Brenda. I'm back.
Did you
Go ahead,
question,
Stacy. Now finish your answer.
I was going to say Brenda has been a great champion for looking for ways how we can be seen in the community and partnerships. So she's really a big advocate in finding ways that we can help connect community with our coalitions.
Terrific. Thank you, Stacy. Brenda, did you hear the question about the CSB and how it's been, what is your experience with how it's been able to scale the work that the coalition has been doing and really transforming the landscape of support in your state?
Right. So with the 28 communities, and you heard the today's stories from 2 of those 28, I would say that it has applied in both our large cities, like you heard in the Kansas City area, as well as our very small rural areas. So it seems to fit very well regardless of what sort of area or community, even cultural communities. And I think one of the things that has really been an unexpected surprise has been the city governments and the county governments, because as you saw in the picture that Stacy showed, there's a proclamation that is read by the city or the county government at the end when the designation is given. So we have had city and county commissioners read a proclamation, and it's really raised awareness among our civic leaders about breastfeeding really outside of areas that we might normally be able to reach. So that's just been one example of being able to go outside the normal group.
Wonderful. Thank you. And did you, I think when Stacy was talking, when you said those 28 communities that have met all of the 6 criteria, does that cover 80% of babies delivered in the state of Kansas?
Yes, we did the math. Those 28 communities, and you look at the number of births that occur in those communities, that is 80% of all babies born in our state. So many of those communities are very high population density areas like Wichita and the Kansas City area, but it's also, as you can see from the map, geographically very diverse.
That's impressive. We have a question here from Shakia for Stacy, and either Stefana, you could take that too, but Stacy, it refers to your online breastfeeding support group. And Shakia asks, how did you get your online breastfeeding support group to grow? She has a monthly group now, and they have an average of 400 views, but she would like to reach more people.
Well, it's a closed group. We have a page and then a group. So the closed group, we found that by asking women to add other breastfeeding women that they knew, then the community grows fast. So for instance, every week we get about 1,000 requests every week. Because as you know, women leave the group when they are finished breastfeeding and then add the one. So we have a continual stream of 500 to 1,000 women wanting to join our group. And so we also encourage women to post about our group and what it meant to them. So especially during Black Breastfeeding Week, we wanted them to post their personal testimonies to support that women don't stop breastfeeding because of problems. They stop breastfeeding due to lack of support. And when you see someone who is actively breastfeeding, you don't know the trials they may have gone through. So those testimonies on their page, plus our link, continually asking members, hey, please add the pregnant women you know, please add your personal testimony. That's what helps the group grow. And even no matter where I travel, so I recently went to Texas and some lady was running me down and she was like, I know you. I'm like, okay, strange person. You're the lady who started the breastfeeding group. If it wasn't for you, I wouldn't have breastfed 2 years because I just cried every night. And that's what makes it worth it. I do have about 25 admin that help. And again, we are all about personal testimonies, helping them know that it is difficult, but with the right support, they can get what they need and just attend to their baby. So that's what it's been for me.
Thank you, Stacy. And again, I mean, if anything, today's phenomenal presentation just says what the power of collaboration is. You know, when you have a state breastfeeding coalition that plays the role of a backbone that has the infrastructure and the ability to support local coalitions, cultural coalitions, startup and host conference calls, meetings, host conferences, and for free. What a difference that makes to be able to share that resources, and then truly the examples of resilience, wisdom, strengths from the community that have always been there. And as we said, all of the questions that we have, the communities have the answers, and sometimes it's for those who work at the state health department, who work with the levers for change, to be able to hear directly from the communities is really crucial if we want to move the needle. So again, thank you so much to Stacy and Stefana, and to Brenda too, for the work that you all are doing in Kansas. And I know that we will continue this conversation in the learning community. So folks, if you have any questions, I'm going to look and see if there are any new questions that have come up. Thank you for a very informative, lots of great comments about how informative this and wonderful this presentation has been. So thank you again. And we will now turn to some quick updates from USBC. And first, I'm going to invite Miriam Rodriguez to share a little bit about USBC's, how USBC is helping or supporting the September monthly observances. Miriam?
Kenny. So this is Miriam. Just to highlight our September observances, like you said, September is National Preparedness Month, and I'm going to be sharing a couple of links for you all to take a look at that webpage. We also are in the start of Hispanic Heritage Month that goes through October 15th, and we have a webpage that features a lot of information in the Latinx community, resources, tools, and materials, and we are updating these resources very frequently. So for either page, if you have any materials that you've created or that you want to share or that you are a fan of and want us to highlight, please share those on our webpage, and I can add the submission link as well to the chat box.
Wonderful. Thank you, Miriam. And now I'm going to invite Camille Abbey, our PR and events manager, to talk a little bit about USBC's revamped policy at HQ.
Right. Hi, welcome everybody. So yeah, we've been, the advocacy team, all of the team here at USBC has been working hard on updating some of our advocacy pages. So a lot of them can be sent to out in the chat. Miriam, if you could pop a couple of the links, you'll see we have links here, but these are in a PDF. So we can send you a couple of links just to the main homepage would be great. But we have 3 tools active right now that it would be really helpful if we could get all of you to sign on to ask for. Particularly, we would like to have some more help supporting the Mamas Act, and the CDC funding is also very relevant for right now. A lot of you probably got an email from us asking you to please sign on to that this Sunday when we sent that out. So if you could particularly have a chance, it takes really no time at all to click into those, and then you'll be invited to, of course, ask anyone else that may not have asked their own legislators to sign into these, either the act or the resolution in support of National Breastfeeding Month. We would very much appreciate that. As far as the policy headquarters, we have got a lot of pages that we've revamped. So one is about active legislation. So you can go right now and see we have widgets up there, so you don't have to go tracking down the bills that you're keeping an eye on that pertain to breastfeeding. You can let us do that all together for you. And so that's a page we're really excited about. Made it a lot more convenient. We've condensed all of the existing federal and state legislation into one place, so you can kind of have a quick read. You don't have to remember anymore the name of a bill you might be looking for. It's right there, and you can just have a look through what's happening. Obviously, the past, current and past federal policies and initiatives are still live. The letters and public testimony, none of that has changed. And the breastfeeding reports. So if you haven't yet engaged with the breastfeeding reports for your state or territory, I'm sure many, if not all of you have. But just to know, those are a quick download, one page from the website, click into your state, easy, and those are there for all of your advocacy efforts. It makes a pretty big impact, we find, when the representatives are able to see kind of what's going on right there in their state. So as well as we've created a USBC resource page, so just to support advocacy efforts, to kind of remind folks, if you're not getting the wire, you really might want to consider getting the wire every week, because there's a lot going on in there to help you stay up to date. So those are a few of the pages that you can see in the policy, and we're calling it Policy and Actions headquarters. So you'll have a look on the USBC website, and we hope to see you there. And in the tools, we'll hope to see your names. Thanks so much.
Great, thank you, Camille. And we, we've been hearing from you, and our communications team has been working just amazingly on revamping parts of our website to make them more user-friendly and bring you the information at your fingertips. So the breastfeeding report is also, for most of folks in the coalition, are known as the state breastfeeding fact sheets. So we use the terms synonymously. So if you're wondering, it is and at this point, we have them at the state level and also for Puerto Rico, our territory. And now for our next update, I'm going to invite Danae Schmidt, our Member Relations and Operations Manager, to share about the exciting info sessions. Danae?
Thanks, King Kenny. Can you hear me okay?
Yes.
Great. So the USBC membership team is hosting virtual informational sessions. We actually only have one more that's scheduled for tomorrow from 2 to 3 p.m. Eastern time. As many of you know, USBC expanded our membership categories earlier this year to include community-based organizations, as well as our state, territorial, local, tribal, and cultural coalitions. And so if you are interested in membership, learning more, or if you have some questions about the process, this is a great session to attend. We encourage you to go ahead and register, and I've chatted out the info session registration link. If you can't make the session, I still encourage you to go ahead and register. We'll be happy to send you the recording of the session as well. And that is it from me.
Wonderful. Thank you, Danae. And from our staff team, thanks for all you do. Every day we are inspired by the work that happens across the nation at the grassroots, and we get our energy and our impetus to do better from you all. So thank you for sharing. And again, we'd love to highlight other coalitions, community-based organizations, national nonprofits. So if you're doing something that you're excited about, please write to Miriam or me or any member of our staff team, submit an online, and we'd love to feature you on one of our webinars as well. We will continue posting relevant resources during this month for the September Observance Month. So please visit our website and please share with us resources and details about your events, and especially if you're doing things during Hispanic Heritage Month or anything on emergency preparedness, infant feeding, things from your cultural coalitions. USBC will be happy to highlight and amplify your efforts via our social media channels. And lastly, we want to know how we are doing and if we are meeting your learning needs. So please complete the evaluation at the end of it. We also ask you for suggestions for topics. So those are very helpful. We read them. We bring you the topics and areas that you most want to hear about. And you also get to then, if you complete the evaluation, download a certificate of attendance. So thank you for all that you do in your communities, and a very big thanks to Stefana and Stacy and to Brenda for the phenomenal work that you are doing in communities across Kansas. So thanks everyone, and until next time, goodbye.